Hey y'all, Reese Hammock here. I've had a lot of questions about how antivenom works and how different snakes do different things to the body. But our main thing that we're going to go over today is what is antivenom? What is it made from? What does it treat? Why do you give antivenom? When do you give antivenom? And a whole bunch of other questions that people have. So the backstory is in the 60s they came out with something called Wyeth antivenom. It was based out of horse serum. It wasn't really well refined. And what they would do is they would inject the horses with the mild amounts of the venom of the snake, mainly rattlesnakes, and they would take out the antibodies after that animal had produced enough antibodies and use it as antivenom. Well, the same concept is the way it is now. However, they use goats and sheep for the antivenom, and they use 4 different snakes. So it's a broad spectrum treatment for pit viper bites. You don't need to identify the snake. You don't have to kill the snake, figure out what it is. If there's swelling, the doctors can figure that out. But the quicker the administration of antivenom, the better off the patient's going to be. I've done papers on this, and it's proven time and time again, the quicker the administration of antivenom, if it's a confirmed bite, the faster the recovery process. However, that's not what we're going to go into. Crowfab is one of the antivenoms. Antivenom is another. Crowfab is made from the western diamondback rattlesnake, Crotalus atrox, the eastern diamondback rattlesnake, Crotalus adamantius, the cottonmouth, Acristrodon piscivorus, and the Mojave rattlesnake, which has a neurotoxic factor to its venom, and that is Crotalus scutellatus. So all 4 of these snakes are individually, and each venom is individually injected into a goat or a sheep, and they wait until the animal doesn't hurt the animal, but it has enough antibodies to produce the antivenom, which is basically all it is antibodies destroying the venom before it destroys you or destroys cells. So in Crowfab, it's mainly cytotoxic and hemotoxic factors that that we're treating. However, with the neurological factor of the Mojave rattlesnake, that actually takes out a lot of the, like, let's say, rock rattlesnakes or even the timber rattlesnake that has been known to have neurotoxic factors to its venom. So like I said, it's a broad spectrum pit viper treatment. Coral snakes are completely different. It's completely different antivenom. And then there's Antivenom, which is specifically for rattlesnakes. Now, one of the questions that I get a lot is like, okay, and this is one that I dealt with when I was a kid when I was bitten by a cottonmouth. What is the pediatric dose compared to the adult dose? Well, there really isn't a pediatric dose or an adult dose. It's you give the antivenom until the symptoms and signs are reversed or get better, the swelling goes down, and there's an obvious sign of lack of pain, which of a snake bite is very painful. Women have compared it to childbirth. So when you're looking at a snake bite, swelling is a big factor, but also necrosis, tissue death is a big factor, because really we're looking at time versus tissue. So when you're looking at a snake bite, it's really getting them to the antivenom that they need so that the venom doesn't destroy bone, muscle, capillaries, and blood vessels, as well as the cellular level, and also compromise the immune system and lessens the effects of the chances of having a secondary infection like a staph infection or something like that, because it will sometimes, with rattlesnake bites or copperhead bites, if not treated soon enough, it can leave a big wound. So the quicker the antivenom is administered, the better off the patient's going to be. It reduces the risk of opiate infection, doubles the chances of the recovery process, and it's just an all-around good practice to have. Comment below if you have any more questions about this, and I'd love to hear from you guys. Let me know if you like the video, subscribe, and hope this was helpful.
What about